everybody. Thank you so much for joining us today. My name is Emma Whiteman, and I'm Senior Content Marketer and Tech Writer here at Triumvirate Environmental. I'm so excited to be your moderator for today's Reproductive Hazards in the Lab, How to Stay Safe webinar. Before we get started, I'd like to share that everyone's mics and cameras will be turned off for the entirety of the webinar. You can use the questions tab on the right side of your screen to communicate with us and ask any questions. Please also keep in mind that you will receive a copy of the slide deck and recording in the days following the event conclusion, so you can reach out if your question goes unanswered. I'll also share contact information for our presenter at the end of the event should you need to reach out to us for any reason. So with that, I'm very pleased to introduce today's speaker, Carrie Colbert. Carrie Colbert, ASB PMP, is a senior EHS consultant at Triumvirate Environmental with 5 years of experience. With an academic background in the sciences, she's developed a deep interest in chemical management and has explored safer solutions that go above and beyond those suggested by regulatory agencies. In her role, she works largely in the biotech and life sciences fields and industrial sectors, working to ensure that client EHS programs are accurate and effective amidst changing regulations. In addition to her career, Carrie has earned multiple professional certifications, including the ASP, PMP, My Green Lab Ambassador, and NFC OSHA General Industry Professional Certificate. Carrie lives in Maryland and enjoys hiking, reading, and serving the community. So with that, I'm very pleased to turn it over to Carrie.
Thank you so much, Emma. So as she queued me up, today I will present to you on reproductive hazards in the lab and how you can stay safe. So before getting started, I wanted to take a moment to clarify terminology. So as I go through this presentation, I will be using terms to refer to people's sex in the biological and physiological sense. So the terms I will use will include male, female, and intersex people. So while most of us are very familiar with the binary of male and female characteristics, intersex individuals are born with sex traits, whether that be chromosomes, gonads, or genitals that do not fit the typical male or female definition and will be included in this discussion. So these are common terms that do not focus on gender and are used in the literature to capture all people in the workplace. So with that, in the webinar today, I will discuss the reproductive hazards that exist, including relevant dangers and common use cases. I will review proposed or safe limits for reproductive hazard exposure. And at the end, I hope you'll understand ways to protect yourself and your team from reproductive harm, including PPE, safe handling, training you can provide, and general reproductive health program implementation. So this is a quote from the OSHA Reproductive Hazards webpage. So while more than 1,000 reproductive chemicals have shown reproductive effects in animals, most have not been studied in humans. So in addition, most of the 4 million other chemical mixtures in commercial use remain untested. The inadequacy of current knowledge, coupled with the ever-growing variety of workplace exposures, pose a potentially serious public health problem. So this is from the preamble to NIOSH's NORA statement on reproductive hazards. So as we go through, a common theme of regulatory agencies admitting to gaps in research will begin to shine through. But we'll just leave this here for now. So when I look at exposure events, I'd like to acknowledge that health outcomes are rarely caused by a single isolated incident, but rather by complex, cumulative, and interactive combinations of many different factors, right? These factors can be environmental, social, or personal. So while one exposure event to a hazard can be the cause of a health effect, we cannot deny the impacts that the other factors play as well. So as I move forward through this presentation, please try and keep this framework in your mind, right? Recognize that there are many compounding factors that impact worker health, especially reproductive health. So I'll refer back to this as our multifactorial approach to exposure events. So what are reproductive hazards? So reproductive hazards, by definition, are substances or agents that may affect the sexual function and fertility in adult females, males, or intersex people, as well as developmental toxicity in offspring. So developmental toxicity here are any adverse toxic effects to the developing embryo or fetus. So all reproductive hazards are xenobiotic, which means that they are foreign substances to the body. So in a workplace setting, most literature and regulations surround chemical and physical hazards. These are commonly referred to as our reproductive toxics and environmental hazards. So for chemical hazards, this includes drugs, metals, solvents, our polycyclic aromatic hydrocarbons. And on the physical side, they mostly include radiation and heat hazards. So while there have been strides in biosafety, even in just the past few years, there's still a large lack of enforceable regulations surrounding reproductive toxins, right? That's our biological reproductive hazards, outside of our regular standard bloodborne pathogens such as hepatitis B or other infections. I also wanted to include reproductive hazards, outside reproductive hazards in this webinar. Because if we don't, we are not following our multifactorial approach to exposure events, right? These are hazards we are exposed to outside of a work setting, either by choice or because of the environments that we live in. And this can include alcohol consumption, smoking, or consumer products that we use. So my background is steeped in biology, so I did want to get a little into the science of what happens when a person is exposed to a reproductive hazard. So reproductive hazards produce effects through either direct or indirect action. So directly, xenobiotics, remember, these are foreign substances to our bodies, can be structurally similar to endogenous compounds like hormones or nutrients. So in this way, the body more easily accepts them. The hazard can also cause immediate tissue damage, like with high doses of radiation, or it can cause chemical reactions in the body. People who have been exposed to lead are familiar with this one. So indirectly, after exposure, some reproductive hazards require metabolic processing, either within an organ or the body in general before the toxic effect is exerted. So the effect is then exerted by a direct method. An example of this would be the bodily response to polycyclic aromatic hydrocarbons. So it is important to note that reproductive toxins may work through more than one of these mechanisms and can produce many different effects. So what are the actual effects, right? As biologic organisms, we have several mechanisms for responding to toxic stresses. Our primary organs used in eliminating xenobiotics are the liver and intestines. The hazard is processed and eliminated through processes including conjugation, hydrolysis, or by metabolizing the toxin to a less toxic or more easily excreted compound. And to repair the damage that is done, our bodies will renew or increase protein synthesis to replace non-functioning proteins destroyed by the toxin, and or they will screen for DNA damage and excise and replace the damaged region. So that's a lot of science. I know typically with EHS professionals, we kind of stick to just the immediate effects, but I wanted to give this background so that we can better understand as we talk through this. So as with other occupational hazards, reproductive hazards can enter through a person's body through inhalation, absorption through the skin or mucous membranes, injection, and ingestion. It really just depends on the physical state of the hazard and how that person is exposed. So exposures can be either acute or chronic. Acute exposures here typically being the short-term high-level exposures that cause immediate or delayed reproductive effects. And there's evidence from studies showing that even a low-level exposure to a reproductive hazard can have immediate effects. So on the other side, right, there are chronic exposures caused by long-term low-level exposures. These are particularly dangerous in my opinion because they cause cumulative effects that are often paired with other medical issues and can go unnoticed or can be mistaken as other non-occupational ailments. There are studies that also support that workers can indirectly or directly expose their loved ones to reproductive hazards by bringing traces of the hazards home on their person, clothes, shoes, or even on their tools and vehicle. And this last note, right, for offspring, timing is important. Early gestation is the time where offspring are more sensitive to birth defects and can also be the time when most people do not know they are even pregnant. So with that, the impacts on target groups. So if the body is unable to respond properly, there are serious long-term, long-lasting impacts that can occur within our target groups. So our target groups here are females, males, and offspring. Unfortunately, there is still a lack of research in how reproductive toxicity impacts intersex people. So while not every reproductive hazard causes each and every impact for each and every target group, they can cause one or more of these impacts to occur in people. These impacts are the commonly occurring impacts, and this is not an exhaustive list. So historically, research about the impacts reproductive hazards have on health has been largely focused on the most dramatic aspects of birth defects, right? Especially when we look at well-known reproductive hazards like lead. More recently, however, there is a growing interest on hazards for fertility, not just in females, but males as well. There's been more of a growing concern, especially with discussions around chemicals like PFAs. So with this, I wanted to highlight infertility. So infertility by definition is the inability to conceive following 1 year of regular unprotected intercourse. So this is reduced to 6 months when a partner is aged 35 or older. There are also studies that support different sexes can have potentially different timeframes of toxicity exposure symptoms. But outside of people looking to produce offspring, there are other impacts that I wanted to highlight. So exposures to reproductive hazards can cause sexual function disorders in both males and females, leading to erectile dysfunction and changes to vaginal chemistry. Exposures can also result in ovaries aging quicker, which can cause early menopause. Exposures are also linked to the big C word, right? Cancer, in all three of our target groups. So if we remember back to our framework of multifactorial approach to exposure events from the beginning of the presentation, these impacts can be exacerbated by cumulative other factors as well. These can be choices made outside of work, like people who are regular drug or tobacco consumers, or it can be other outside exposures, like from environmental things that people do, right, outside of people's choices, like lead paint in homes or consumer products that contain reproductive hazards like makeup or children's toys. So while all workers are vulnerable to reproductive hazards, there are more vulnerable populations that we need to consider in this discussion. So I have put males at the top of this list because they are a group that is more likely to avoid discussing medical concerns with the doctors. And up until recently, we're not a group that was included in discussions of reproductive hazards and fertility concerns. They are also more likely to take higher risks at work, which can expose them to more reproductive hazards. There is minimal research on how reproductive hazards impact intersex people. While we can make assumptions based on the research in male and female populations, it leaves out a portion of the target groups out of the equation entirely. Obviously, we have our people trying for pregnancy and younger people as vulnerable populations as they can be directly impacted by reproductive hazards. Another group that is often left out of the conversation are people outside of childbearing years and people beginning menopause. Often reproductive hazard research and reproductive health research in general is centered on individuals who can produce offspring, which often leaves a gap for those outside of that time of their lives. And again, I want to make it clear that all workers are vulnerable to reproductive hazards, and these groups may just be more vulnerable due to physiology or cultural awareness. So I wanted to provide a few examples of chemicals that are currently labeled as reproductive toxics. They all carry this reproductive toxicity GHS pictogram, which you can see in the bottom right. This is not an exhaustive list of reproductive toxic chemicals by any means. Some common use ones are formaldehyde, which is used in cell fixation and R&D spaces. Acetone, that's another common material, which is used in the final step of glassware cleaning. There's also chloroform, commonly used solvent and has medical uses as well. And some of these materials are common use in the workspaces, and employees may not even realize the reproductive hazard associated with the materials they are working with. So when it comes to OSHA regulations, right, the ones specifically listed on the OSHA webpage for reproductive hazards are listed here on our left. It is a relatively short list of standards given what we've learned about reproductive hazards. OSHA also has a link to additional resources, which we can see here on the right, which takes us to a web page that lists out links including cadmium, carcinogens, coal tar pitch, etc. There's a far greater focus from OSHA, less on specific reproductive standards and more on the overarching hazards that are prevalent in the workplace. So both OSHA and NIOSH focus on reproductive physical hazards and hazardous chemicals, which leaves a large research gap when it comes to the reproductive toxins and biosafety. So just really quickly, I wanted to include this. NIOSH most current studies on reproductive hazards are female-centered, and they look at the following substances, right? For ethylene oxide, this is used commonly to sterilize medical supplies. Hospital workers and workers involved in sterilization of medical supplies may be at more of a risk to ETO. And more than 100,000 women are exposed to ETO in the workplace. We have our PCBs. This is a big one, especially if you're in Maryland, which were commonly used in the electrical industry until 1977 when they were banned. Products made with PCBs remain in the workplace and in the environment, and NIOSH is investigating a potential link between PCB exposure and breast cancer. And then studies to PERC, the main solvent used in dry cleaning, will help to evaluate its connection to cervical cancer. An estimated half of dry cleaning workers in the United States are women. So while it's not a regulatory agency per se, NIOSH does advise agencies like OSHA and can help to shape that legislation. Speaking of legislation, right, let's look at the proposed or safe limits of reproductive hazard exposure. So as we think about our regulatory framework, it's important that we consider the following. Most chemical exposure laws in the US regulate based on risk. So this risk is calculated by multiplying a chemical's toxicity and anticipated exposures. So federal regulators do not account for all exposures and therefore understate risk and underregulate chemicals. And then current legislation and research on exposure limits holds healthy male workers as the norm. That's a really big one that we will see as we go through this. So when hazards are classified as a reproductive hazard, it goes through a classification assessment. This assessment does utilize assumptions which leave gaps. There's currently limited monitoring and biomonitoring data when it comes to reproductive hazard classification. Data is reliant on underprotective default assumptions, Aggregate exposures across routes and pathways are not considered. Regulators often cannot take the multifactorial approach to chemical exposures, and therefore cumulative exposures to multiple chemicals and non-chemical stressors are not considered in these assessments. So as I stated earlier, intersex individuals are not considered in these assessments, leaving out a group of individuals that make up, I think, anywhere from 1 to 5% of the population. And then with healthy males as the norm, exposure limits were not set for the entire working population. So why do we even care? Well, we care because exposure to reproductive hazards impacts all sexes and generations of people. There are serious economic, physical, and emotional consequences that we have to consider. With increasing numbers of chemicals released into the environment, many are not properly classified, so when workers are exposed, they may not realize or understand the magnitude of the exposure. Regulatory agencies are aware of this. However, chemical assessments can't keep up with the number of chemicals on the market and the lack of chemical standards, which make exposure assessments less likely. So this in turn puts the onus on employers. It may be putting individual companies and employers at legal risk for consequences of exposure that employees have to reproductive hazards. There are also large public health consequences. So I'm sure everyone has heard the news of the US birth rate declining. The US birth rate has dropped to historic lows, right, with a record low fertility rate of 1.6 births per woman in 2024. And it's a continuing downward trend through the years. So the overall fertility rate has also declined with that. So while this is linked to many factors, it is imperative that reproductive hazards are addressed sooner rather than later to protect people and also to protect birth rates. So in the reproductive sphere, there are some explicit laws that protect workers. So these include the OSHA General Duty Clause. This requires every employer to provide a workplace free from recognized hazards that are causing or are likely to cause death or serious harm. There's also California Proposition 65, which requires businesses to warn individuals about exposure to chemicals that can cause cancer or birth defects and other reproductive hazards. The Pregnant Workers Fairness Act, which requires employers to provide a reasonable accommodation to an employee's known limitations related to affected by or arising out of pregnancy, childbirth, or other related medical conditions. Of course, unless the accommodation will cause the employer an undue hardship. And then, of course, finally, Section 7 of the Fair Labor Standards Act, which requires employers to provide basic accommodations such as time and space for breastfeeding mothers. So while these are maybe not specific to reproductive hazards, these are current laws in place that protect these groups. So now into the nitty-gritty of the regulatory side. There are many regulatory agencies who have a hand in managing reproductive hazards. So this includes the UN GHS, USA EPA, and the Toxic Substances Control Act, right, or TSCA. The US OSHA, of course, everybody's favorite, the FDA, and there are also state protections. So while there are other agencies that have a say in worker safety, such as NIOSH, right, the National Institute for Occupational Safety and Health, I wanted to focus on the regulatory agencies that set mandatory standards and enforce them through inspections and fines. I included GHS regulations or classifications because to me, it is a framework that is most inclusive and provides a building block approach to issues that the US has not quite nailed down yet. I've also highlighted the EPA and OSHA as these are the two big regulatory agencies that have enforcement power and explicit limits set for reproductive hazards. So this is the UN GHS classification for reproductive hazards. They do so in categories. So at the top, you can see we have category 1A, 1B, 2, and effects on or via lactation. So this is how the GHS classifies based on different descriptions, right? So category 1A are known human reproductive toxicants. These are based on human evidence. 1B is presumed human reproductive toxicants based on animal evidence. Category 2 is suspected human reproductive toxicants based on evidence from animal and or human studies. And then effects on lactation interfere with lactation or can be present in breast milk, which can cause harm to breastfed children. So all of these, except for effects on lactation, carry the health hazard pictogram seen in the bottom left. They also carry signal words, except for effects on lactation. And they all have specific hazard statements. So these hazard indications would be found either on the container itself or on the material safety data sheet. So some examples of chemicals as they fall into this category. We have some big ones in 1A, right, are anesthetic gases. How do we know that it impacts reproductive health? Well, we know that from human-based evidence, especially our lead, our PCBs, our radiation. In 1B, right, we have ones that are presumed based on animal evidence, and the GHS lists out all of their testing methods in explicit detail. All of these regulatory agencies do. In category 2, these are suspected human toxicants. This is our cytotoxics. That's a big one in the news right now. And of course, vinyl chloride. And then I could only find one really good example of a well-known one, and that's lindane for effects on lactation. So the EPA has taken action to reduce exposures to certain chemicals that are persistent, bioaccumulative, and toxic, right? PBT, under the Toxic Substances Control Act. So the Toxic Substances Control Act, TSCA, requires the EPA to compile, keep current, and publish a list of each chemical substance that is manufactured or processed, including imports in the United States for uses under the TSCA. So the inventory contains flags for chemical substances that are subject to manufacturing use or use restrictions. Currently, there are about 86,000 chemicals on this list, with only about 42,500 being active. They also use the guidelines for reproductive toxicity risk assessment and the guidelines for developmental toxicity risk assessment that use existing data to evaluate the potential toxicity of environmental agents on the reproductive system and offspring. It is important to note that the dates attached to these documents are a little outdated. They do not have more current versions that I could find online. And the EPA also has documentation on test guidelines for chemicals and testing for the impacts to reproduction and fertility. So this document here would list out the procedures that they use to classify chemicals as reproductive hazards. So OSHA. OSHA does list PELs, right, permissible exposure limits for reproductive hazards, which are our legally enforceable 8-hour time-weighted average limits on airborne concentrations of reproductive hazards. You can find these PELs on the tables listed in this standard. There are also limits listed in specific standards, like for formaldehyde or for radiation. However, OSHA recognizes, and they say this multiple places, multiple times, that many PELs are outdated and inadequate for ensuring protection of worker health. So these standards were issued shortly after the OSHA Act. So for those of you who don't know, that came out in 1970. and many have not been updated since that time. So with that, OSHA recommends employers consider using alternative occupational exposure limits because they recognize exposures above some of these alternative occupational exposure limits. So this can help workers, especially with ones like Cal OSHA's limits, NIOSH's, NIOSH's recommended exposure limits, and of course our ACGIH threshold limit values. And one of the only ones regarding biosafety are biological exposure indices. So the FDA guidelines focus on traditional drug testing, specialized oncology, and biotechnology-derived products impacts on fertility, embryo-fetal development, and offspring throughout development. So regarding workplace safety standards, they often align to OSHA's recommendations for workplace safety regulations. The FDA will typically complete these studies using animal models to assess risks before human clinical trials. So the primary guidance document for reproductive hazards from the FDA is detection of reproductive and developmental toxicity, and this harmonizes international standards for assessing drug effects on reproduction and development. The FDA also has a few other notable guidance documents that I've listed here for your reference. Feel free to look into them. They're really interesting, especially when you want to look at kind of more what is on the consumer market side, or if you're involved with the FDA regulations. So many states are considering or have enacted policies addressing reproductive chemical hazards. So this is about 30 states that are considering it or have done so. Included in this list are Maine, Minnesota, Washington, and Vermont. Some states have specific laws requiring ingredient disclosure or restricting toxic chemicals like BPA or PFAS that impact reproductive health. This includes California, right? Remember our California Prop 65 and New York. A majority of these states' protections protect consumers, though, and do not provide safe working instructions. So how do we actually protect ourselves and our colleagues from reproductive hazards? Well, for starters, we can identify known reproductive hazards. So there are some reproductive hazards listed out, right? And we can know and identify them by reading safety data sheets. These can provide valuable information on exposure limits and how to safely work with materials. We can also look at the manufacturer containers, right? The containers that the material originally came in. These are required to have hazard statements, pictograms, and they identify hazards as well. There are also many reference lists that are freely available to you online, although not necessarily enforceable, depending on, of course, where you're located. These lists are great resources in providing insight into chemicals that are considered reproductive hazards outside of the eyes of conventional OSHA, EPA, and other regulatory agency regulations. So this includes our California Prop 65. If you couldn't guess, I like that one. We have the International Agency for Research on Cancer, and then, of course, the EU's registration, evaluation, authorization, and restriction of chemicals. These lists are really great resources. Even if you don't want to use them for your own work, I would suggest just taking a look and learning kind of about how they classify versus how our government classifies. So we've identified hazards that we know are reproductive hazards. The second thing we need to do is consider our employee risk. So consider these two situations, right? One definitely seems riskier than the other. So on one side, there's one 100 milliliter bottle of formaldehyde on our facility. It's properly labeled and stored in the chemical cabinet. It's used solely in a chemical fume hood by a trained individual. Our other situation are multiple 1 liter bottles of formaldehyde They are also properly labeled, but they're just stored throughout the facility, some on the bench, some in cabinets, some we don't know where they're stored, and it's used open bench by staff members. So in both of these cases, we would need to understand the risk that we're putting employees at. So how we would do that is by conducting a risk assessment or a job hazard analysis. So I have included both of these, as some people are more comfortable conducting one over the other. These assessments can help to identify hazards before they occur. So depending on the degree of the material on site and how it's being used or where, you may want to perform multiple assessments based on chemical location, area in the facility, or even just by department. This will help to provide your baseline and establish what risk is acceptable. Oh, there we go. So I hope that this triangle looks very familiar to everyone. This is the hierarchy of controls. So this is a framework proposed by our friends at the NSC, right, National Safety Council, and lists out the different ways we can control hazards. So starting from the top, we have our most effective control of elimination, which in a perfect world is how we would control all workplace hazards. But moving down in effectiveness, we could also maybe substitute the chemical for a less toxic alternative. We could utilize ventilation or isolation methods like chemical fume hoods. For our admin controls, we could rotate workers and provide training. We can adhere to exposure limits for the exposure limits we know. And we could provide PPE as our final control measure for workers when they use the material. So with training, we have our general trainings where we can include discussions on reproductive hazards in trainings like our hazard communication, our bloodborne pathogens, and our new hire orientation. I'm hoping that you're all doing trainings like this. This is really important, especially if you work with hazardous materials. You can also train to the hazard itself. So if employees only work with one reproductive toxic, it could be worth it to have a training on specifically how to manage it, how to work with it, how to be around that material. In some cases, it is required based on regulatory standards that you do train to the hazard itself, like for formaldehyde. So it would not be a webinar about protecting workers without talking about personal protective equipment. While it is the least effective control, it may be a worker's last line of defense in protecting themselves at work. So in all cases with PPE, you should read the safety data sheet and conduct a PPE hazard assessment to determine the most appropriate PPE for the work that's being done. So that being said, I would consider gloves of appropriate material for the work being done. The thickness and type of material can have an impact on its efficacy. We would know what type of glove to use based on the safety data sheet. I know that can be very broad. OSHA also provides some guidelines on gloves, so check that out as well. Of course, we have our lab coats or Tyveks, which can be appropriate for protecting our skin or clothes from exposure. We have lead vests that are appropriate for protecting from radiation hazards. For eye protection, I would suggest goggles over glasses to properly protect from chemical splashes or biological material splashes. And in the cases where other ventilation is not feasible, respirators may also be necessary, depending on the hazard and the route of exposure associated with it. So how do you start a reproductive health program? Well, step one is brainstorm and identify our hazards, right? What jobs in your company could be hazardous to reproductive health? Conduct those risk assessments and JHAs, and just overall think, are there groups of people who may be more vulnerable here? Step 2, we want to develop our solutions. We want to offer options to avoid tasks involving reproductive hazards, especially if people are in a more vulnerable population. If an employee cannot completely avoid a reproductive hazard on the job, we want to try to reduce it where possible. Maybe we develop a reproductive health SOP. Maybe we develop a SOP directly related to the material itself. All of these are good examples of how we can create solutions to control the hazard. And then step 3, we want to institute those control measures, right? We want to create the SOPs for the program and work instructions for working with reproductive hazards. We want to provide medical surveillance when necessary. We want to have inclusive policies for all sexes and genders in all stages of life. And we want to make sure that we have continuous improvement and checks. So developing programs like these is a core component of how Triumvirate's EHS consulting services team helps organizations strengthen worker protection and compliance. So what does a reproductive health program actually look like? I know it can be very hard without directives from regulatory agencies to explicitly list out what it should look like. But from what I've seen in my experience and also through my research, effective reproductive health programs are employee driven. We want to make sure we're getting feedback from employees and building off of their experiences. They're transparent. We want to show what people are exposed to and what you are going to do about it. There's also monitoring when needed, whether this be health monitoring or physical monitoring. And of course, they're continuously improved. This is a big one. As always, we want to make sure that our programs change with us. We want to make sure that they are always better so that we can just continuously improve the safety of our workers. So in conclusion, reproductive hazards impact all people, both at work and at home. It is a multi-generational, all-sex hazard, and it is a total workers' health issue. While there are many regulations surrounding reproductive hazards, it can be difficult to navigate through them. I suggest utilizing the regulations available, but be aware of limitations within them. It's always best to be more conservative when it comes to safety. We also want to make sure we're protecting your workers and yourself, right? Begin brainstorming with your team. Take a look around your work area. Provide training and equipment when needed. Consider implementing a reproductive health program for your site. Do whatever seems best for your team and your site. And while there's so much more information I could talk about regarding reproductive hazards and deep dives that I could go into, we wouldn't be able to include it in our 1-hour time slot. So if this is interesting to you or your team, there's a plethora of information out there, including many peer-reviewed articles and scholarly research on specific reproductive hazards and other ways that reproductive health programs have been implemented. So I encourage you to take the time to check them out. But with that, we can open it up to questions.
Hey, Carrie, thank you so much for that super informative presentation. There was so much great jam-packed information in there, and that's very clear because we have tons and tons of questions coming in for you. We're going to jump right in. One thing that someone is asking about here is we've been covering a lot of EHS intervention, but if the data is lacking in humans, what's the criteria or basis for identifying these potential reproductive hazards that do require this sort of EHS intervention?
So while there are many studies on reproductive hazard effects, wait, can you repeat the question? I'm sorry.
Yeah, no problem at all. If the data is lacking in humans, what's the criteria or basis for identifying the potential reproductive hazards that require EHS intervention?
Okay, so this is a really great question. Thank you. While there are many more studies on reproductive hazard effects on animals, there are some reproductive hazards that have been identified, right, by GHS or OSHA. So as we saw by their own admission, it is a severely lacking list, and it is not all encompassing. So as far as criteria or a basis for identifying reproductive hazards, I would start, of course, with reviewing our safety data sheets, first for materials that are already classified as such. Then I would branch out into other chemicals that have health hazards in your facility. There are many chemicals that don't get the proper hazard classification until after many people have been exposed and show serious symptoms of exposure. So, because our bodies are made of dependent systems and organs, it is important that other health hazards are considered as well. So, if you're to take a conservative, proactive approach, I would suggest you include health hazards in your reproductive hazards management program as well.
Yeah, that's a great answer. Thanks for providing that there. This kind of leads into this next question that I'm seeing here, but often in accumulation sheds, there's not the same amount of engineering controls as like a research lab. So what would be some good measures to take for protecting waste handlers from the hazards of reproductive and potentially other toxins?
This is a great question as well, especially one that I'm familiar with working at Triumvirate. So in the webinar, I discussed reproductive hazards as they are actively being used or related to work, and not so much how to manage them as waste. So health hazards don't typically disappear when they become a waste. My suggestion when working in any enclosed space or with a hazardous material is to complete a job hazard analysis before beginning work, and when any concerns arise, right? The JHA focuses mostly on the relationship between you, the worker, the task, the tools, the environment itself. And ideally, after you identify the hazards, you'd be able to take the proper steps to eliminate or reduce them to an acceptable risk. So also with that question, ideally, right, all of the waste containers would be closed unless you're actively adding waste. So this can potentially narrow down the time of concern for your JHA to the time in which you are actually being exposed, right? When you're adding waste, or when you're venting the drum, or when you're grabbing it from whatever SAA. So if you need help conducting JHAs, your EHS representative should be able to assist, or you can reach out to third-party resources like Triumvirate.
Awesome. Thank you, Carrie. Here's a question from someone asking, is reproductive harm adequately accounted for during any sort of typical yearly HAZWOP or physical? And if this isn't accounted for, what changes could be made to those physicals or to those programs to include tests for reproductive harm?
So HAZWOP or physicals, they are medical surveillance exams. So these exams are required for any employees who are exposed to hazardous substances above an OSHA PAL, who are a respirator for more than 30 days a year, right? Who become sick for possible overexposure or work on a hazmat team. So I'm going to assume you probably work on a hazmat team, whoever's asking this question. So typically your physician will review your medical and work history, and kind of look at the past exposures if you've had any to hazardous materials. There's also that physical element to the exam, which can include blood and urine samples to check for signs of exposures to chemicals, and of course a test for hepatitis B. But hazmat exams can vary greatly depending on the physician, depending on the biases associated with it, right? If you don't have as hazardous of exposures or as a job as someone else, they may not take it as seriously or do as an in-depth of an exam. They don't really test for reproductive harm specifically, but they do look at exposure effects in the general sense. So my suggestion to you would be, if you have concerns about exposures to a reproductive hazard, This is definitely something that you should bring up to your EHS team member and your physician at that time of exam.
Awesome. That's great advice. Thanks for answering that one. Here's a kind of interesting one that's a little different, but how can women chemical workers, or any chemical worker really, best advocate professionally for better safety measures in the workplace surrounding teratogens and other reproductive hazards and actually be received seriously by male leadership?
This is a wonderful question, especially with it being Women's History Month, so thank you. I I believe the best way to advocate to leadership in general for any issue is to come prepared, right? We need to have our clear, evidence-based, concise statements that align with our company goals. So if it were me, right, instead of framing this conversation around one aspect of reproductive hazards, I would bring forth evidence like the kind you've been presented with today, and make it known that reproductive hazards impact all workers. Then I would come up with solutions to the problem. I find that leadership often does not want to be presented or bombarded with problems where they have to manufacture the solution themselves. So if you come with a plan, it can be more easily supported or accepted. And finally, I would suggest that you relate it back to the company's interests. So if you have a company goal of sustainability, for instance, you can point out that green chemistry perspective should be taken, right? It would be better to substitute a less hazardous chemical for a reproductive hazard chemical, which can create both like a cost savings aspect and save money on the purchasing and waste disposal sides. So this is just like an example, but I would suggest, doing some legwork and sitting down with your management team to properly present it.
Yeah, that's a great answer. And if anyone needs help coming to any sort of leadership, definitely let us know if we can put some talking points together. Anything for you, we're here to help. So, okay, this is kind of the flip side of that question, but coming from someone in leadership, I'm assuming based on the question. But if there's so many aspects in play, like genetics and health, how can you accurately set an exposure limit for all employees equally that makes sure everyone is protected?
So unfortunately, as we saw, federally regulated exposure levels are set for healthy male workers. So this can create a dynamic where we are only considering the exposure limits for part of the workforce. I think the statistic now is that men make up about 67% of the workforce. So I would suggest framing reproductive hazards as not just hazards that impact females who are trying for offspring, but frame it to them that reproductive hazards can impact anybody that's exposed to them. It's a total worker health issue. And also really press to them that policies need to be inclusive of all groups of these people.
Awesome. Thank you so much. This is a similar-ish question, but how can someone tell if other lab conditions are augmenting or affecting the impacts of reproductive hazards as a whole within that lab?
So there are many ways you can do it. A good place to start would be a JHA or a risk assessment, right? We look at not just the task itself, but also the conditions as a whole. There are other ways that we can make sure that lab conditions are not, affecting reproductive hazards or exacerbating them. We can do so by air monitoring, right? You can get a 5-gas meter. You can make sure that all of your ventilation equipment is running correctly. And also just look at housekeeping in general. We want to make sure that we are, like the person who submitted the waste shed question, that we have all of our waste containers closed, that we aren't storing chemicals improperly, and just doing these regular checks or assessments can help to tell us about the lab conditions and what they're doing in this case.
Thanks, Carrie. And it's people are really interested in this idea of this GHA, these hazard assessments that you've been talking about. So would any typical hazard assessment be enough to review and mitigate for reproductive toxin risks, or are there specialized, or are there other aspects that need to be considered for it to be a specific reproductive toxin hazard assessment?
So it really just depends. OSHA's put out really great work instructions on job hazard analysis. Quick Google search, you can find it online. That being said, there's no one size fits all for JHAs. Anybody in the safety profession knows that. People tend to tweak them to their liking or have a format that they prefer. As long as it just includes that JHA portion, they're usually okay with that. But for reproductive toxins, right, we can take the information that we know about them, right? The different kinds of routes of exposure, and really tweak those JHAs to be material specific and also job specific. So just looking at those two factors, I would say that you can work with a typical JHA, but just using it, understanding the framework of those two things.
Awesome. Thanks for putting that into perspective. Someone here is saying that they work with reproductive toxins within a lab space, and they're wondering how they can ensure that their family and friends are protected when they go home or go out to see their friends. Are there steps that they can take to ensure that those around them are protected from these hazards as well?
This is a very big question, and I know we only have 30 minutes, so I will do my best. So if you work with a reproductive toxic, right, it can come home with you on your clothes, on your tools, in your car, on your shoes. But it also really depends, right? It's not like I've worked with a material, a reproductive toxin in one lab and I don't enter that lab all day, that a reproductive toxin isn't on me. That may not be the case. So really just looking at how you are working with or around that material, and just being cognizant of that, right? So like, let's say I have my regular work clothes and I put on my lab coat and I take off my lab coat when I leave the lab. It's unlikely, but not impossible, that there are reproductive toxics on my clothes. So if you're around people who are especially vulnerable, so this could be people trying for children, or those of us who do have small children, it may be in your best interest to change your clothes first before interacting with them, because kids like to be all up in your business. So little steps like that and just recognizing how you work with it can really help. But that being said, there are so many reproductive toxins outside of work, which I would also suggest to the people online to look up. It's really easy. There are a lot of organizations that talk about consumer products, and especially consumer products tailored to women that have reproductive hazard effects. So being cognizant of what you're consuming outside of work or what you are giving to people outside of work, right? A lot of toys can have reproductive hazards or can be listed on California Prop 65. Just be cognizant of the materials that you're using and the work that you're doing.
Awesome. Thank you so much, Carrie. I think we have time for one more really, really quick question. But if you had to one way to say, like, how can someone ensure that their state is taking reproductive health seriously during regulation making? Is there like one key thing that you can say, or a tip for those that want to, make this more commonplace to have these protections?
Yeah, my number one tip is to check into your regulations, right? A lot of states will have state-specific regulations, especially from the OSHA side. And state regulations are regularly updated. So you can also ask more from your elected representatives and lobby them for help.
Awesome. Thank you so much, Carrie. You answered so many great questions and put on such an incredibly informative event. And thank you everyone for attending today. After this event, you will be directed to a short survey, but the same survey will be sent out with a follow-up email, also containing a copy of the presentation and the recording. We'd greatly appreciate your feedback on the event, including any ideas you may have for future topics. Thank you so much for your, I don't know, sorry about that. Please feel free to reach out with any further questions to Carrie or myself. Thank you so much for your participation, and we look forward to seeing you at future events. Take care.